Hi, today I am going to talk on routes of administration of drugs. Now, the various routes of administration of drugs are oral, percutaneous, parenteral, that includes intravenous, intramuscular, intrathecal, inhalation, and few others. The basic purpose of administering the drug is to make it available into the plasma. This can be achieved by various routes of administration. We will take one by one and see that how these routes of administration are providing the drug into the blood. Now coming to the oral route is the most preferred, safe, convenient and economical from the point of view of administration. Most commonly used drugs are given by this route for systemic effects. Sometimes oral routes are also used for the local effect. Say for example antacids, which are taken just to neutralize the gastric acid. Sulfasalazine is used for the treatment of ulcerative colitis. So some of these drugs which are taken orally, but they are not entering into the bloodstream. They are just acting at the local GI tract. Some of the disadvantage of oral route could be gastric discomfort, irritation, vomiting, and irregular absorption. Another point which sometimes is important for oral administration is that some of the drugs are extensively metabolized in the intestine and liver before reaching to the blood or systemic circulation, and so they do not provide the adequate concentration into the blood, which is known as first pass effect. Oral route requires cooperation of the patient. Certain patients, say for example if the patient is vomiting or having a condition where he cannot take oral, there is a difficulty in swallowing, or there is a pain in throat, or patient is unconscious. In some of these conditions, oral route cannot be considered. So patient cooperation is of utmost importance for this route of administration. Now what is first pass effect? The orally administered drug are first exposed to intestinal mucosa and then to the liver via portal circulation. And the drugs with high hepatic clearance are extensively metabolized before it reaches the systemic circulation. So, due to this first pass effect, the bioavailability of these drugs are very low. They require very high oral dose to get the effect, or the alternative of this could be to use another route of administration that is called sublingual or parenteral. We will discuss these two routes in the subsequent slides. The liver diseases affect the clearance of drug and increases the bioavailability. Some of the drugs showing first pass effect are glyceryl trinitrate, propranolol, morphine, salbutamol, and there are so many other drugs which are showing the first pass effect where the drug are extensively metabolized and they are not suitable for oral administration. Some of the factors which can modify the oral absorption. So these are important points to consider, because just taking the drug orally does not mean that the drug will always be effective. So some of these points, the foremost is pharmaceutical factors. The pharmaceutical factors could be whether you are taking the drug in a solid state or you are taking in the form of liquid or suspension. The solid could be tablet or capsules. And for these kind of dosage form, the dissolution and disintegration is very, very important. So during the pharmaceutical technology, these things are taken into considerations, that what is the dissolution of the drug, what is the disintegration time of the drug, because they are quite significantly affect the absorption of drug. Then if it is a liquid formulation or it is a suspension form, so accordingly the oral absorption may modify. The liquid suspension or liquid formulation is relatively faster absorbed as compared to solid preparations. The other factor could be presence of food in the stomach, because certain drugs are either poorly absorbed in presence of food or they interact with food and they impair the absorption into the bloodstream. So it is very important to know whether this drug has got any food effect or not. Then gastric emptying is another point which is important for oral absorption. Certain drugs and certain diseases, they delay the gastric emptying and accordingly the absorption of drug. One very good example is migraine, where the gastric emptying is delayed, and so the effect of simple analgesic is not that fast. But once you combine this analgesic, say paracetamol, with a prokinetic drug, then the gastric emptying is increased, or gastric emptying is fastened, and so the absorption, and you get a quick effect. So certain diseases and drugs, there are so many drugs which belongs to categories of anticholinergics and others, they modify the gastric emptying time. So it is important to know whether gastric emptying is affected or not. Then if there is any disease of gut or any surgery of the GI tract, that can affect the absorption of drug. The surface area of GI tract, like intestine, is having much larger surface area than the stomach. So most of the drugs which are taken orally, they are primarily absorbed through the small intestine. Microbiota in the intestine also alters the absorption of drug. As we have discussed, that any metabolism, the drugs which are primarily metabolized into the gut epithelium are extensively metabolized into the intestinal mucosa. They show the first pass effect and they can modify the oral absorption. Then another phenomena which can affect the drug absorption is P-glycoprotein, which is PGP, which causes efflux of drug from the intestinal cell and reduces the absorption of drug. For the same reason, the concomitant cardiac disease or renal problem or any liver disease could affect the absorption of drugs. Say in case of congestive heart failure, the patient has got intestinal edema, there could be intestinal edema in these problems, and because of that, the absorption of drug is compromised. So all these conditions, concomitant illness, the use of any other drug along with some other drug, or the disease condition of GI tract, or presence of food, and overall the pharmaceutical doses form, all these are some of the factors which can modify the oral absorption. Now a few words about enteric coating tablets. What is enteric coating? The drugs that are destroyed by gastric acid or cause gastric irritation, they are coated with enteric coating. And also some of the tablets that are effective in ileum or colon locally, where you do not require the drug to be present in the stomach, like mesalamine for the treatment of ulcerative colitis. So some of these drugs, they are coated with a gastric resistant polymer. Just one example is Eudragit, which are insoluble at low pH. And so the drug is not affected into the stomach, and it is dissolved only at pH above 5 into the small intestine and absorbed. So enteric coating is primarily done to protect the drug from the gastric acid, or if the drug is causing gastric irritation. For example, enteric coating the Disprin or the Equisporin, the tablet of aspirin, that is enteric coated because of the propensity or the likelihood of causing the gastric irritation. The sublingual dosage form is in which the drug is kept below the tongue to avoid the first pass effect. Once the drug is kept below the tongue, it bypasses the intestine, it bypasses the liver, and it directly goes into the bloodstream through the circulatory system, through the heart. And it is suitable for drugs which are showing extensive metabolism, and it directly enters rapidly into the systemic circulation. It has got relatively a quick onset of action. Some of the drugs like buprenorphine for pain, glyceryl trinitrate for angina, fentanyl again for pain. Some of these drugs are used sublingually for faster onset of action as well as for a better therapeutic effect. The buccal route of administration is sometimes used where the drug is kept between lips and gum until it is completely dissolved. It is mostly used for systemic effect. It can also be used for local effects. And if it is used for systemic effect, the absorption is sustained, more sustained and more predictable. For the local effect, some of the drugs like hydrocortisone lozenges are used for aphthous ulcer in the mouth, and clotrimazole lozenges for oral candidiasis. So buccal route of administration is one of the option which is used, though not as common as oral administration, but for certain drugs it is one of the option. The another route of administration is rectal, which is known as suppository, and this is used either for local effect on the rectum like bisacodyl, that is Delcolex, suppository, which is used for the treatment of constipation, primarily for children. It is also used primarily for children. No exposure to the gastric acid enzyme with this route of administration. There is less first pass effect because directly it bypasses some part of liver and intestine. Rectal administration is suitable for patients who are not able to take oral drugs. For example, in condition of status epilepticus or in severe conditions, the rectal administration can be used. The rectal administration causes irregular and incomplete absorption. It is not very convenient. Patient may not prefer most of the time, and it can cause local irritation at the site. Some of the drugs which can be used, like diazepam for status epilepticus, steroids, they are used for ulcerative colitis, metronidazole for some of the anaerobic infection or sepsis. So this route is used sometime in very selected conditions, selected type of patients where oral route is not suitable. The transdermal administration is through the skin. It can be for topical or local application or local use, local effect, or it can be for systemic use where the drug is absorbed through the skin. The absorption of transdermal drug depends on the physical property of the drug, whether there is particle size, lipid solubility, and some factors. It also depends on the surface area of the skin, where how much area it is applied. It also depends on the vehicle which is used for making the transdermal solution, transdermal preparation. The skin condition also decides the absorption of drug, like injury and disease conditions of the skin. For example, in burn cases, the absorption of drug, if it is applied locally, is very, very high because the epidermis is lost and most of the drug are absorbed through the dermis. Occlusive dressing to increase the hydration is also one of the methods to increase the systemic absorption of the drug. The age also influences the absorption through transdermal route. Like infants, they absorb drug faster or more absorption as compared to adults because of the softer skin. The drugs which are used by transdermal route are hormone replacement therapies, fentanyl patch, scopolamine patch, diclofenac patch, and antigen, that is nitroglycerin. So, many preparations are used for systemic purpose by this route of administration. The region which are commonly used for transdermal route is post-auricular, that is behind the ear. It can be applied in the scrotum, it can be applied in the scalp, it can be applied on the forearm. But the absorption will depend on the site of application. As you can see, the highest is behind the ear and the lowest is in the forearm. The parenteral route of administration are injectables. They are primarily used for emergency purposes. They are used for patients who are unconscious or those who are unable to take oral. It is also one of the only route for certain biopharmaceuticals and advanced therapies. Most of the biopharmaceuticals, or almost all the protein therapeutics, are to be given by injections. In parenteral routes, we have subcutaneous, we have intramuscular, we have intravenous, we have intradermal, like BCG vaccination and testing or sensitivity testing of the drug, where the drug is just injected on the skin into the dermis. The subcutaneous route, the drug is injected below the skin, and it is suitable only for drugs which are non-irritant to the tissues. The drug is given in form of either injection, or even it can be given in form of implants, where the drug is implanted below the skin and the drug is slowly and constantly released for providing a therapeutic effect. The absorption by this route is affected by mobility of the part, the blood flow of that area, temperature, and vasoconstrictors. So if there is a vasoconstriction of that area, the absorption will be slow. And this, just one example very commonly discussed, is xylocaine with adrenaline. The xylocaine is a local anesthetic which is used with adrenaline for purpose of local anesthesia, regional anesthesia. The purpose is for this because adrenaline causes vasoconstriction and it allows xylocaine to stay for a longer time. So the effect of xylocaine anesthesia persist longer than if it is not given with adrenaline. The effect of subcutaneous injection could be sustained if it is in oily suspension form or it is given in form of implants. Some of the examples of subcutaneous long-acting implants are medroxyprogesterone acetate injection, which is available as intramuscular depot as well as in subcutaneous form as well. Testosterone subcutaneous and goserelin implant, which is given below the skin. The absorption of subcutaneous route, especially for the depot preparations, could be over a period of weeks and months. The intramuscular route of administration is also very common for most of the injectable drugs, where the drug is given into the muscles. Most common sites are either deltoid in the hand, in the arm, or gluteal region into the lower limb. The absorption of intramuscular drug or the intramuscular injection is faster at deltoid than gluteal region due to the presence of fat. The absorption of intramuscular drug is faster if it is in aqueous solution form. The absorption is slower in females due to high fat mass, because fat, the fatty tissues, they reduce the absorption from the site. The intramuscular absorption is quite unusual, or it may be unusual in persons who are very obese or very thin. This could be very slow or very fast. The intramuscular absorption can be very slow if it is oily suspension, what we call as depot injections, which can be given weekly or monthly, primarily to improve the compliance of the patient. Some of the injections which are given by route intramuscular depot form, like flufenazine, risperidone, in the treatment of schizophrenia, where the patient compliance could be an issue. The problem with intramuscular injection could be pain at the injection site. There could be formation of hematoma if it is not properly given. There can lead to abscess There can be nerve damage if the proper care is not taken, and sometimes it can increase the muscle enzyme that is called CPK, that is creatine phosphokinase. The intravenous route is given to administer the drug in concentrated and diluted form directly into the vein. It reaches directly into the blood circulation. It is given mostly in emergency situations like myocardial infarction, stroke, or patient who are unconscious. Intravenous is also a very suitable route for drugs with poor bioavailability, because when you give intravenous, as we have seen in previous sections, that intravenous administration causes 100% bioavailability of the drug. The intravenous administration has better control on the doses form, as well as better doses control and better titration of the doses. The IV or intravenous can be given in form of a bolus, where you just give the drug slowly at one time, or it can be given in form of infusion by putting the drug into a bottle with some solvent, could be saline or could be dextrose or dextrose normal saline, and it can be infused slowly at a different rate depending on the condition of the patient and the nature of the drug. The complication of intravenous administration could be thrombosis, embolism, tissue necrosis, sepsis, and if it is inadvertently injected into the arteries, it can lead to the spasm and gangrene of the part. So the intravenous administration, though it is very commonly used by healthcare workers, the paramedics, but it should be very, very important to isolate, to identify the vein and give the injection very properly. The intra-arterial route is not a very common route of drug administration, but occasionally it is injected into an artery to localize its effect in a particular tissue or the organ. The drugs which are used, for example, liver cancer or head and neck cancer, where the drug is given just to accumulate or to enrich in the area of liver or head and neck, the drug can be given by intra-arterial route. The diagnostic agents which are used for various kinds of imaging techniques, they are given intra-arterial. And one of the important points for intra-arterial administration, it requires a practice and careful administration to the patient. The intrathecal route is commonly used by anesthetists, where the drug is injected into the subarachnoid space. It goes to the CNS without concern of blood-brain barrier. There is no restriction, but there is a high risk of neurotoxicity by intrathecal administration. It requires an adequate training to inject a drug by intrathecal route. And some of the drugs like local anesthetics, the methotrexate for certain cases of meningitis, in cases of opiates, these are the drugs which may be used by intrathecal administration. The inhalation is the drug administration for volatile liquid or gases like general anesthetics. They provide rapid access to the systemic circulation. It can be in form of aerosol. Some of the drugs are given in form of aerosol inhalation for local effect like in asthma and other lung diseases, COPD, chronic obstructive pulmonary disease, where corticosteroid or beta agonist, all these drugs individually or in combinations, they are given in form of inhalers. The patient or the public knows it primarily as an inhaler. So they are a form of inhalation therapy. Some of the antibiotics can be used in a form of a nebulized form, like in case of cystic fibrosis, though not very common in India, and also for Pseudomonas infection. The inhaled nitric oxide is used sometime for the treatment of pulmonary hypertension, and the advantage, like sublingual route of administration, is that inhalational route also provides the first pass effect, and so there is no issue of a bioavailability by this route of administration. And lastly, coming to the intranasal route, which can also be used for local effect in the nasal mucosa, or it can be used for systemic effect through going to the bloodstream. It is remarkable for peptides because they are digested by the gut if they are given by oral route. So a lot of peptides are used by intranasal route. The local effect of for intranasal administration could be like steroid and decongestants, which are commonly used for treatment of allergic rhinitis or sinusitis, where the purpose is to allow the medicine to work on the local mucosa. But for systemic effect, the intranasal administration can be used, say for example desmopressin, which is used for the treatment of diabetes insipidus. Calcitonin is used intranasally for the treatment of osteoporosis, and buserelin is the treatment for prostate cancer. So intranasal route is also a very useful route for both local administration as well as systemic administration of drug. Thank you.